Honorable guests, esteemed colleagues, ladies and gentlemen. 3 exciting days of discussions, networking, and scientific input at the 10th EDCTP Forum are behind us. Unfortunately, the ongoing pandemic kept us all from gathering in beautiful Mozambique this year. Casual chats over dinner, scientific discussions during the breaks, or simply having fun together could not take place as we all had hoped. Nevertheless, even under these difficult conditions, we were able to experience 3 fruitful days. This could not be taken for granted. My big thanks, therefore, to our hosts, the tireless organizers, and especially to you, dear EDCTP community, for this successful event. Ladies and gentlemen, EDCTP is facing new challenges, as it has many times in the past. One of them is that EDCTP is on the verge of a new program, the Global Health Partnership EDCTP3. EDCTP2, the current program, will no longer publish new calls for proposals. That task will fall to the new program from 2022 onwards. Such a program transition may seem mundane, but the challenge requires a number of important actions from all stakeholders. First, a stock-taking. What was good? How can we do better? Where were the difficulties and what are the reasons? Second, a review and confirmation or even reinforcement of all our commitments. And third, a strategic reorientation that captures the future tasks and convincingly translates them into a program for another 10 years. I am pleased to say that this process is in full swing, and I am grateful for the work and time already invested by all. At this point, I would like to encourage those who are still hesitant about the new program to get involved and help shape a successful new partnership. The second and perhaps infinitely greater challenge on which I would like to share with you some reflections is beyond the immediate scope of EDCTP. I am talking about the consequences of the COVID-19 pandemic for the global health architecture, and in particular with regard to international cooperation in research and development. 20 months after the outbreak of the pandemic, it looks like the global community has finally understood the wake-up call. It is extremely regrettable that previous wake-up calls, which predominantly affected resource-limited countries, did not have this effect. Anyway, we have to seize this opportunity now. Currently, we see efforts towards better pandemic prevention and response at all political levels, nationally and internationally, for example at the UN organizations, the G7 and G20, and at the European and African Union. And as I interpret all the reports and discussions, it seems that research and development is an area where international cooperation has worked remarkably well. It has led to fast and impressive successes, such as the development of new vaccines in record time. However, there's still room for improvement. Better coordination, international cooperation at eye level, integrating the needs of and strengthening capacities in resource-poor countries are just a few challenges that have become obvious in this pandemic. Ladies and gentlemen, and especially you, dear colleagues who have been involved in the EDCTP program for a long time, don't these discussions and plans sound somehow familiar to you? Is this not something we have been doing in EDCTP for a long time, albeit in a narrower framework? And for this reason, I would like to raise the question here, perhaps somewhat provocatively, whether EDCTP could serve as a blueprint in this new global research cooperation, and what experiences and skills it could bring to the national, regional, and international processes. Let me mention some of these experiences and skills that I believe would be useful to incorporate in ongoing policy processes. The first skill necessary is to bring life into a top-down approach. Let's be honest, both EDCTP1 and EDCTP2 were in the first place politically motivated programs largely driven from the global north. And I would like to add that these top-down political initiatives are absolutely necessary to move things forward. But above all, it takes committed people to bring these initiatives to life. It is to the credit of the EDCTP community, the scientists, the representatives of the participating African and European countries, the people in the Secretariat, and the supportive colleagues of the European Commission that they have turned this into a largely science-driven and evidence-based initiative. A second learning experience is how to build sustainable success. It certainly takes time, money, and commitment, and also in EDCTP we will never have enough of these. But above all, it needs trust and the awareness of being in the same boat. This can only be achieved through continuous and intensive cooperation. EDCTP has a long-standing experience in how this indispensable trust as a prerequisite for success can be sustainably built. At EDCTP, we have also learned that sustainable cooperation is a gradual process. Cooperation must be initiated and maintained before it ultimately becomes a matter of course. As an impressive example, I would like to mention the regional networks of excellence. Making them a success story of EDCTP has been neither an easy nor a fast endeavor, but the efforts to establish this capacity-building measure ultimately paid off. The important contribution that the networks were able to make in their countries to combat the COVID-19 pandemic and the previous regional epidemics is impressive evidence of this. Finally, we now have to translate experience into action. Building sustainable structures for global health research cooperation is a huge undertaking that, to my firm belief, can only succeed if we draw on experiences already made. EDCTP, with its 20-year history, has a wealth of such experience and knows how to translate experience into action. Taken together, I think that we, the EDCTP community, are living up to many important prerequisites for a successful cooperation in global health research. By working in an equal partnership, by prioritizing local needs, by acting in an integrative manner, and last but not least, by putting strengthening research capacity at the core of our initiative, EDCTP has established a solid base for the future. We are well prepared for the new Global Health EDCTP3 partnership. Coming back to the title of my talk, I'm convinced that EDCTP can definitely play an important role when the global community strives to be better prepared against health crises. It is perhaps a bit far-fetched to state that EDCTP could serve as a blueprint for better international cooperation in global health research. However, EDCTP is certainly a best practice example for a series of elements which feed into this huge collective global endeavor. It is our task as member state representatives to assure that this precious example of global health research initiative is duly considered when our political leaders sit together to shape the future global health space. Reinventing the wheel, as tempting as it may sometimes appear, is, to my firm conviction, not an option when we need reliable solutions to urgent problems. In this regard, I am extremely grateful to the EDCTP Secretariat and to our Executive Director, Dr. Michael Makanga, but also to the European Commission and colleagues from the Member States for their continuous efforts to communicate what EDCTP is doing and what successes have already been achieved. Presenting EDCTP as a side event at this year's Science Summit on occasion of the United Nations General Assembly marks a milestone in these efforts. Last but not least, we should not forget that every success of EDCTP we communicate is rooted in the hard work of highly committed scientists in Africa and Europe. Supporting them has been, is, and will be at the core of the EDCTP program, no matter what the strategies and political agendas. Germany, as a founding member state of EDCTP, will not cease to support this important work and to continue writing the success story of EDCTP together with all of you in the new EDCTP3 program. I'm extremely grateful to all the committed partners which are already shaping this program, and I call upon all other European and sub-Saharan African countries to join us and to be part of a success story. Thank you very much.